This is the position that we want to be in when we're stressed, with our shoulders forward, our head tucked, our hips up to our chest. The fetal position. This makes us feel safe. Either that, or we feel like we want to run. So when you think about this position and you think about all the computer use that we're doing, where we're sitting at chairs for long lengths of time, or we're hunched over, or we're looking at our screens with our head forward, you can imagine what that does to these two areas of the body, your primary core and your secondary core. A lot of us are familiar with the word core as this area of our body, right around our pelvis. Our abdominal muscles also includes the back of our hip, our low back, our hip flexor area. All of this we're used to calling our core. But tension and the importance of this area is just as important as the secondary core. This guy's head backwards. The secondary core is your neck and your pecs and your shoulder area. Now, the reason both of these areas are called your core is because the word core means important. It's like the most essential. It's like at the center of. And if you think about our bodies, what do you think is the most important part of our body that's the most protected in our body? It's our nervous system. Our brain is protected by our skull. Our spinal cord, which is all the nerves that innervate everything that happens in our body, is right in our spinal column. So this area, our head and our spinal cord, is the core of us. Everything else, our arms and our legs, are just the appendages. And they're important too, but the core of us is this nervous system. So when our body is under stress or has some sort of experience of trauma, where is it going to hold tension? It's going to hold tension to protect the most important part of us, our neck and our head, as well as our pelvis and our tailbone. There's also a bunch of organs in here that, that our body wants to protect as well. So I have spent a lot of time sharing information around why tension develops here, because this area, our primary core, is very important for it to be aligned, relaxed, and strong so that the alignment of our legs works properly and the alignment of our spine works properly. You can think of this like your foundation in your house. You want that to be nice and sturdy. You don't want it to be crooked. You want it to be nice and aligned so that everything on its way up and down works well. This also makes sure that your nervous system at the tail end is happy as well. If there's tension or pulling in this area, if you have a tight hip flexor or a tight piriformis, that's going to irritate your nervous system and your vagus nerve. And there's more to that. But on the flip side is your secondary core, which is your brain, your head, your neck, and your shoulders. When you're under stretch, you're going to have tension in this little muscle called your pec minor, which is right here. It's a little tiny guy. That's what pulls you forward. When you're forward, your head goes forward and you can't line up your spine, and then your whole nervous system is compressed and irritated and twisted, especially if there's tension more on one side than the other. So tension there makes it harder for you to even have good alignment here, which then creates tension here at the base of the skull. Now, even without poor posture, people end up with muscle tension in the back of their neck, again, due to stress or looking down. I mean, how many of us look down at our phones all day long? Or, if we've got a hobby or something where we're looking down, without releasing that looking down position or that jutting forward position, we end up with all kinds of tension here. When you have tension at the base of your skull and your pec minor, that creates a phenomenon that makes your nervous system, your brain, your spinal cord, and your brainstem, which is right here, very, very unhappy. So if you're trying to maybe release tension even in your pelvis or help your pain in your knee go away, if your nervous system and your brain is on fight or flight, you're going to have a very hard time doing that. In addition, if you're trying to meditate or get out in nature or help calm yourself with a nice warm bath, that is not going to be very effective if you have muscle tension. So muscle tension and mental tension are connected, right? If you have stress, you have muscle tension. If you have muscle tension, you have stress. Both those things are connected. So if we can address muscle tension in the primary core by releasing the front of the hip, the iliacus, and the psoas muscle, release the back of the hip with the piriformis and the deep hip rotators, and address the secondary core, which is housing the jewels of our nervous system, by addressing the base of the skull and the pec minor. That gives our body the best chance at our nervous system functioning as in its ideal scenario, and for the mechanics of our body to work the best.